supine position. You want to make sure the bed is flat before turning them over and placing the bedpan underneath them. After placing a resident on the bedpan, what position should you leave them in? Raise the head of the bed to a comfortable position. So leave them with their head raised to push pressure on the bladder to encourage them to eliminate. What is important to remember when taking a resident off of a bedpan? Hold the bedpan flat to the bed when you turn them over. That prevents spilling that bedpan all over the bed. Next procedure, urinal. Once the urinal is properly placed for the male, what do you leave with them? Colite and tissue. How is the amount of urine in the urinal determined? We measure in cc's, or cubic centimeters. After the urine is disposed of and gloves removed, hands washed, what is done next? Assist the resident to wash their hands. So after you clean your equipment, take off your gloves and wash your hands, assist them to wash their hands. Next procedure, emptying a urinary drainage bag, or what they call a Foley bag, on the unit. What supplies are needed to empty a urinary drainage bag? Gloves for yourself, a graduated measuring container, and a paper towel. How is good infection control maintained when emptying the urinary drainage bag? Keep the tube in the center without letting it touch the sides. Is it okay to allow the spout to touch the sides of the graduated cylinder as long as the cylinder was clean? Absolutely no. And how is the graduated cylinder disinfected? You rinse it and disinfect it according to facility or company policy. Next, urine specimen collection. Where is the label placed on the collection container? So where do we put the label on the container? I just gave you the answer. It goes on the container, never on the lid. How much urine is required for a urine specimen? You want the container at least half full. So half full with the urine container. And how is the specimen transported to the lab? In a biohazard bag or a lab bag, which has that biohazard symbol on it. Stool specimen collection. What should the resident not do when attempting to collect a stool specimen? Urinate or put toilet paper with the sample. What is important for the caregiver to do when collecting stool specimens with those tongue depressors? You're going to collect at least 2 tablespoons from different areas of the stool. Know to use how many pairs of gloves? 2 different pairs. And collect how much stool? At least 2 tablespoons. And then next, application of an incontinent brief. When applying an incontinent brief, what side goes away from the skin? The plastic side. And how is an incontinent brief disposed of? In a trash bag taken